A frantic call has just come in from the outer southeastern suburbs.
Cars hit a motorbike rider and chunks came off his leg.
Yep, and is he awake?
He's awake.
And is he breathing?
He's breathing.
The air ambulance is required for a rapid response to the accident scene 60 kilometres away.
Is there any blood pouring or spurting out?
It's an open wound. A bone came off, meat came off.
You're okay, just keep him still, keep reassuring him. You're doing really well.
Just clear left.
Thanks, mate. Lifting.
Flight paramedic Ray is on board. He already knows the injured motorcyclist is in a bad way.
So we've been sent to a 21-year-old motorcyclist who's come off his bike at high speed. There's first ambulance crew on scene there saying he's got a compound fracture, so quite a large open fracture of one of his legs.
So I'm just going to go straight in from here. We're on finals now.
The helicopter has been cleared for landing at a local oval near the accident site.
So there's goalposts at either end. It looks like it's cricket pitch in the middle with no fencing around it.
Mobile Intensive Care Ambulance paramedics, also known as MICA, were first on the scene. They've now transported Josh, the 21-year-old motorcyclist, to meet the air ambulance.
Nothing really good comes out of a motorbike v car, and it's generally not very good for the motorcyclist. Good evening all.
G'day.
I'm Ray.
Sean, this is Josh.
G'day, Josh. Inside the ambulance, Josh, he's in quite a bit of pain and quite distressed. Now I'm just looking at him going, what are your injuries? It's a bit cold, okay? Just a stethoscope on your chest. Just some deep breaths for me.
Josh can't be airlifted to a trauma centre until he's stabilised. So Ray gets an update on the patient's injuries.
Black eye, as you can see there.
Yeah.
No other bruising or hematomas that I can see. He's had no vomiting or anything.
Okay, all right. You sore in the tummy?
No.
Nothing? Hips?
No.
Sorry, mate. I'm just going to expose you for a second. He's got a compound injury to his knee.
Yeah, we might put a bigger bandage on it. Okay, we're just going to cover it and moisten it. That's all we're going to do. So this knee's borne the brunt of the impact. I could see right through into his joint. How comfortable are you, pain-wise?
So much pain.
Yeah, no, that's fine.
It's not bad, Candy. You want more morphine drawn up?
Yeah.
Josh is in extreme pain at this point in time. If he could rate it out of 10, he would be a 10.
To relieve Josh's intense pain, he's given another dose of morphine.
Card try to beat you.
Yeah, right in the back of it.
Okay, I'm going to move your arm.
He didn't indicate
right.
or anything.
So you hit the back?
Yeah.
You had helmet on?
Yeah.
Leathers? Gloves?
No.
He's wearing a helmet, fortunately, but that's all he's wearing. He wasn't wearing any leathers. He wasn't wearing any gloves. The tip of one of his fingers is amputated off. Direct consequence of when you hit the ground without gloves. All right, so far, what we're looking at is a pretty serious compound knee fracture, so an open knee fracture. Josh is in quite a bit of pain with that, so we'll try to get on top of that.
You know, honestly,
Some
when I
analgesia.
get amputated.
Yeah, knee?
Yeah.
I don't reckon.
You don't?
No, but you know, you're going to need to see an orthopaedic thing. Wiggle your toe for me down there. It looks like he shattered at least his kneecap, perhaps the underlying bones in it. Josh, see that? Ultrasound probe.
Yeah.
Okay, just lets me look in your tummy. I just want to have a quick look, see if there's any bleeding in there, and then we'll get out of here, okay? This doesn't hurt, it's just a bit cold. We're trying to rule out that the lungs are not working properly. We're trying to rule out that you've got no bleeding around your bladder and your pelvis. If you're bleeding in the abdomen, we want to get you to a trauma centre as quick as we can. Okay, the right kidney looks good, as we expected.
Are you ready for...
Ray, the flight paramedic, has ruled out any internal bleeding, but he's now giving Josh even stronger pain relief for his shattered left knee.
He is now at a point where we can do things in terms of splinting that leg and taking care of it, and he's not really going to feel it. Hands in or hands out? Your call. All right, just need one access to this arm, so this arm's going to have to hang out.
Yeah.
With the pain relief now kicking in, the team can carefully move Josh into the waiting helicopter.
All right, I'm happy to roll. This injury is a significant injury. This is not a week in hospital. This is months. And, you know, the worst case scenario, is he going to end up with a prosthetic joint?
Just in the helicopter now, Josh, okay?
Yeah.
Good lad.
It'll be a 15-minute flight to the trauma centre at the Royal Melbourne Hospital.
Josh, you good?
Yeah.
All right, mate, up in the air soon, okay?
Yeah.
I want you to let me know if that pain starts coming back, okay?
Yeah.
All right, good man. We're in a good spot. We are good to start whenever you are, Tommy.
Great. Thank you so much.
Ray's main job now is to keep Josh as comfortable as possible.
So the concentration now, considering we're going to have to move him onto a bed, is to try to get ahead of the curve in terms of where he's going to feel pain. As soon as he starts showing us any increase, we'll deal with that, give him a little bit more, get him over, and then let the docs have a look at him.
Despite his horrific injuries, Josh has a lot to be grateful for. In the last decade, hundreds of motorcyclists have been killed on Victorian roads. Thousands more seriously injured.
Oh, gentle. Being a motorcyclist myself, I can't really say you shouldn't be on them. I love them. But you have an enormous vulnerability to what's out on the road. And you have an enormous capacity to get into trouble. All right, mate. 10 seconds, we'll be off this.
Josh is one of the lucky survivors, but he's about to find out just how serious the long-term consequences of his accident will be.
I'm looking at Josh and he's a 21-year-old bloke, got the world ahead of him. He's got his whole life ahead of him. And now he's going to be walking around with a fake knee, at best.
Five weeks ago, Josh slammed his motorbike into a moving car. The 21-year-old was worried his left leg would be amputated.
I was conscious the whole time. So I remember hitting the car and flying in the air, and then just the impact on the ground was just like a thug.
Josh still has his leg, but it'll take months of intensive rehab to fully recover.
The damage to my left leg's pretty severe. I had like 150-something staples and stuff in it. I had 5 or 6 surgeries on it. So I had the ankle reconstruction, tibia and fibula, I think have rods in them now. I'm not too sure, but I'm pretty sure my kneecap's metal, and my femur had a rod put in as well, and some screws and plates. And I'd broken a couple of ribs, lost my little finger, and yeah, just hit my head really hard, and that was about it. Yeah, eventually I'll get back on a dirt bike again. I'm not going to let it scare me. But I definitely won't be wearing just a trackies and a jumper next time. I'll be all geared up and properly. Safety first.
Emergency services. Yes, caller, what's happened there?
There's a car accident.
Okay, and what's it hit?
A tree.
Okay. Are there any people trapped?
2 people, maybe more.
Okay, can you see what injuries they have?
I can't see, I'm not sure. It's a real mess.
I'll take the holding point to go on my 300 Belgrade.
Today, wet weather is making the roads treacherous. There's been a huge crash in the Dandenong Ranges, 35 kilometres east of Melbourne.
Scotty, so do you want me on a water lead there, mate? Yeah, we will, thanks, mate.
With roads choked with peak hour traffic, flight paramedic Matt and an air ambulance team are being mobilised.
I'm one to lead now, mate.
It sounds like this vehicle has lost control. It's done a 360-degree turn, gone up an embankment, and then has come onto its side, smashing into a tree. Reports are that the patients are trapped in the vehicle at the moment, so we're going to go off and see what we can do for them.
Rear wheels 2, 1 touching. Yeah, all good on the ground. Might need the raincoats by the looks of it.
Sometimes we're able to land right next to the scenes or very close to the scene. On this occasion, we actually had to land at a local football oval and then get driven by the police up to where the scene is.
Are they still trapped or? Yeah. Okay.
Incredibly, the 2 passengers in the car have managed to crawl out of the vehicle and are already on the way to a local hospital.
How is he?
He's conscious, alert. He was wrapped by his arm and I'm just cutting that last bit to get him out.
Firefighters are now using the jaws of life to free the badly injured driver.
Okay, take it away.
When I look at the impact, he's millimetres away from essentially killing himself from the significant forces in the car accident.
What are we getting the patient onto? We've got a bed set up.
We've got the spine board and we're waiting.
Are they in the process of getting him out now?
Matt's concerned about irreversible damage to the patient if he's moved too quickly.
Have we got access set up in the car? Yeah. No worries.
And something where a vehicle is on the side, the roof has been crushed in, the windscreen's been smashed, so you think a high suspicion of somebody having a spinal injury or a fracture in their spine of some sort. So we need to be very cautious about how much we move those patients as we withdraw them from the vehicle.
Who's that in there with the helmet on?
That's a bystander. So he's got my helmet.
Matt's also worried about the bystander in the vehicle. He was first on the scene and climbed into the car to support the injured driver. The Good Samaritan is now under instructions from the emergency services.
Okay, just stop for one tick before he moves.
As the senior paramedic on the scene, Matt needs to take control.
Sometimes we find ourselves in high-stress situations, and so the pleasantries get put to the side, and sometimes we have to be assertive in our response.
Let's bring the hang on, no, shut up. Just wait one moment. Can we bring the stretcher up, please? And we'll put the stretcher underneath there. Sorry, you all right? Yep.
We need to stop and we need to organise things before we continue on.
Everyone set there? Yep. He can rest back onto the spine board now. Just make sure it doesn't twist. Now, mate, we're going to drag you up the bed slightly, okay? On go, ready, set, go. Righto. Now we'll grab the spine board and we'll move the spine board in just a moment, okay? Keep your arms on your chest for me, mate. Arms on your chest, put them both down on your chest. Arms on your chest, good man.
We're able to grab hold of the patient and support his head and protect his spine at the same time and bring him onto the spinal board and then move the spinal board onto the stretcher.
Okay, and we'll just move down onto the road so we've got a flat surface to work on. Just mind your back there.
And then it's a process of moving him down onto the road where we can reposition him on the stretcher and give him the care that he needs before we put him inside the ambulance.
So, mate, we're going to roll you on your side towards us, okay? You keep nice and firm. Go. All right, and board out. Straps coming through. Straps through. And clear. Go. What's your name?
Sadiq.
Sadiq? No worries. My name is Matt. Now, let's get in the back of the vehicle and we can start again.
With Sadiq now safely extricated from the wreckage, Matt and the team can start assessing the extent of his injuries.
I get you to come down the top end and just start removing clothes and all that kind of stuff.
Just going to cut some of your clothes off, Sadiq.
Yep.
The patient has got an obvious cut on his head and he's got what appears to be a bit of swelling in his arm as well. So we have to try and work out what's actually gone on.
You had a car accident, okay?
Do you remember it at all or not?
No.
No, okay, no worries. Do you know what day of the week it is today?
You decide you want.
When
I assess him, he actually isn't able to tell me the right day of the week or the right month.
Do you have any major pain anywhere at all?
I see a little bit here.
A little bit there.
So it sort of indicates he may have had a bit of a knock on his head and he's a little bit confused from the incident.
But despite Sadiq's confusion, there is one thing he remembers all too well.
Was my kids all right? Yes. Oh, is it your daughter and son in the car or your wife, was it? My daughter and son. Daughter and son. They're okay. They just gone to the local hospital to get checked over, okay? But they're okay.
For the first time, Matt realises the two passengers in the car are Sadiq's son and daughter. Sadiq was about to drop them off at school when tragedy nearly struck.
So we all transport our children around every day, day in, day out. To be involved in a car accident and have the potential to have hurt or injured your children would be extremely distressing for anybody or any parent in that situation.
My kids all right? Everyone's all right. Thank you. Okay. And your family's all right.
Sadiq has no memory of the near tragedy, and paramedics Georgia and Matt are concerned it may signal a significant head injury.
Every 5 minutes or so, that repetitive questioning comes out of him. Has he caused any damage? Has he caused any injury? Was he at fault? How did it happen? All those things keep on flooding back to him.
And do you remember where you were this morning before you left? No. No, you don't really remember that? Don't remember.
When a patient's doing that, I'm assuming that they've had a loss of consciousness, but it can also indicate to us that they've had a bleed inside their brain that can have the potential to deteriorate much further.
Meanwhile, Sadiq's wife has only just heard the shocking news after finishing her train ride to work.
It felt as if everything around me has vanished all of a sudden. Everything has become blank. And I probably don't have a life anymore because what I call my life is my family. And I was saying to Lord that if I have done one good thing in my whole life, then please keep my family safe.
Squeaking in, doors are locked, patient secure, and we're all secure in the back now, thanks. Going to be under 10 minutes to the Alfred trip. 10 minutes. Excellent.
The team are now on the way to the Alfred Hospital to have Sadiq's injuries assessed by trauma specialists.
We look at Sadiq and the type of injuries that are obvious to us at this time. And, you know, he's got a cut on his head, he's got a bit of a loss of consciousness, he's got a sore arm, but we don't know how it's going to affect him in the long term.
Landing gear? Low on 50, landing gear's coming down.
He's definitely a very lucky man from this incident. You only need to look at the vehicle and the damage that's caused to it and where he would have been seated in that vehicle to realise how lucky he was. I'm tipping it's 1 foot either way that could have caused severe injury to all of the members in this family, but on this occasion, they all appear to have been very lucky.
Sadiq, we're at the Alfred Hospital. Can you tell me what day of the week it is today?
Friday.
Friday, good man. What year is it at the moment?
By the time the team arrive, Sadiq's conscious state is already beginning to improve.
Good man. Can you remember where I said we are?
Alfred Hospital.
Good man. A little bit of rain as we come out, mate, so you'll get a little bit wet as we get you through there.
Sadiq's wife is rushing to the hospital, clinging to the hope there will be good news.
First, I was praying for his life. Then I was praying for his good health. Then I was saying, even if anything major happens, still please keep him alive.
Have you got pain at the moment?
All the paramedics and nurses, doctors, so passionately they were helping him. You know, you feel supported. You don't feel alone.
Keep your arms on your chest for me, mate.
It's been 3 months since Sadiq lost control of his car and crashed into a tree with his son and daughter on board.
I just saw one car in front of me and then I tried to avoid that car. After that, I can't remember anything.
Miraculously, his children managed to get out of the wreck with minor injuries, but their dad was not so lucky.
Can you come here, please? Food is ready.
Sadiq's left knee and right shoulder were badly damaged, and he still suffers from chronic pain in his neck and back.
You want some?
It'll be weeks before Sadiq can return to his job as a chef. He still has nightmares about the accident.
It's like, for me, it's worst time in my life, yeah. I'm still having lots of bad dreams. Every night I wake up, so I start screaming at night, and sometimes I cry as well. I can't forgive myself if something happened with my kids. Yeah, thanks God. God save us. Happy birthday to you.
Thank you very much.
Today is his wife Irfat's birthday. She is grateful she still has her family to share it with.
I was thinking all these pleasure, all these fun would have died along with this catastrophic thing if things were different on that day.
No, also my daughter made beautiful cake for you last night.
I already ate half of it last night.
She make fantastic cakes.
Life and death are so close. It's just a fine line. Any moment, everything can change. I'm very thankful that my family is back to life and they are doing fine. It's beautiful, like always.
Because a special love on it. Always extra love.
Well, I'm on the top of Kingsville track, northeast of the Snowy Plains airstrip. I've got a compound fracture in my left leg.
All right, I do understand, sir. How did that happen?
I was sawing a log off the road and the bit from the top side slipped down and jammed my leg and broke it.
Okay, so right now, can you see any blood pouring or spurting out?
No, we put a bandage on it.
All right.
That's my boot on.
This call may sound remarkably calm, but 59-year-old Rob and his wife Trudy are in trouble. With Rob in intense pain from a broken leg, they're stranded in the Alpine high country, 140 kilometres northeast of Melbourne.
And how's the pain? What are you feeling?
Oh, nothing playing.
Yeah, I do understand.
The rescue location is covered in dense bush and darkness is approaching. Micah flight paramedic Ray and the team need to get there quickly to make sure they can get the patient off the mountain.
Righto, 4 minutes run, 10 miles.
We call it tiger country because that's where if things go wrong big, and it's generally either cold or extreme and it's remote.
3 o'clock load, got some people signalling us. Roger.
Right now, getting the chopper down safely is the first challenge.
Paramedics' role in this case is to look out for any obstacles that can endanger the aircraft.
Ray, you can have a look as we're going on the right-hand side. Okay, got you.
The communication between all three of us is now probably at its most extreme. They're calling out basically every foot and every metre and every clearing, every tree.
Right to the ground. Just come down slowly, surface good, slight slope.
Come down, left mate's coming on. And solid.
Slowly bring the power out. Yep, roger.
As they unload the gear, a couple are standing by a four-wheel drive to meet them.
What's your name, mate? Rob, my name's Ray. And I remember turning to the guy I was working with and go, you think that's the patient? It's like, nah. And then he starts hobbling towards us.
Stay there, we'll bring a stretcher to you.
And I go, he doesn't need to be walking. He's got a clearly broken ankle. I can see that from here. And he's going, no, I'll hobble to the helicopter.
Geez, they make you blokes tough. You come to us.
First thing through my mind, it must be a country bloke. You can just tell they're self-sufficient, they're tough. They have to do what they need to do to get things done.
Come with me, come with us. Do the dance, bottom right here, and I'll give you a hand with that leg, okay? No, it's on.
Do you want to take the other boot off?
Right on the ankle?
Down low, yeah.
All right, mate. How about we get you out of here? We might get you in somewhere a bit warmer.
You're in charge, mate. No,
okay, no problem.
As tough as this farmer is, the shock of the accident and the severe pain is starting to take a toll.
Rob's just sitting up on the stretcher now. The face is trying to be stoic, but it's broken. And we knew it was hurting. Yeah, Rob was in some serious pain.
That's hurting.
Now, you normally well, Rob?
Yeah, good to go.
Good to go?
No medication.
No medications.
pills.
Up in the Victorian high country, flight paramedic Ray is about to start treating 59-year-old farmer Rob.
All right, I'll just get this bandage off.
Yeah, just cut it if you have to.
Yeah, I will.
Rob and his wife Trudy were on a four-wheel driving holiday that ended in a terrifying ordeal.
We were just coming down a track and there was a tree over the road. So naturally, Rob, who's a farmer, used to cutting trees and so forth, got the chainsaw and started to get it off the road.
But the tree slipped, ripping open Rob's lower leg and pinning him underneath.
I remember thinking, if I can't get him out, I'm going to have to go and leave him there.
Luckily, it was Rob's jeans that were caught under the log, so Trudy was able to cut him free.
I unzipped the zipper on his boot and could see it was filling with blood. He was as white as a sheet.
Chase, you want to snap a tourniquet on one of those hands for you, mate?
Good, that started the bike.
All right, so what we're going to do, we're going to give you something for that, and I'll keep looking at this a little bit.
As Rob braces himself for the worst, Ray carefully removes the sock to assess the damage.
The sock really started adhering to the clots in the wound and trying to gently pull that off. And we're wetting it down and pulling it off. And yeah, he starts rumbling around on the stretcher again. I don't blame him.
All right, so what's happened? Your sock's probably stuck to your wound.
Yeah.
Okay, so you fracture that quite bad.
All right, mate?
Yeah, just starting to shake, that's all.
The bone's almost sticking out. That makes it look gruesome. He needs to be somewhere where they can take care of that injury and all the possible complications.
It's okay, you're going to be fine.
Flight paramedic Ray has finally managed to remove the blood-soaked sock to reveal what's underneath.
So we get to the point the boot's off, the sock's off. and like, wow, this is quite a big injury. He's got an enormous laceration there. It looks like a fracture, but it could involve possibly a fracture dislocation. It's right down on the ankle, so it's a complex joint, and this is quite a complex injury.
All right, these sting, okay? So relax your foot. Relax your foot.
Pain relief is on its way, but it's so cold. The only place Ray can find a vein is in Rob's foot.
Oh, that bit up my toe. Ah! It's going right up my toe. Oh.
The foot's clearly a pretty tender place to put an IV. It's not something we routinely do.
Does it stop being up your toe now?
Oh, a little bit.
Three-way. Thank you.
So Rob's facade's crumbled now. He's been stoic up to this point. Something had to give, but it's good. Because we've got IV access, and now we can give him all the drugs that we really need to give him to really go and have a look at this leg.
These are the no pain, no gain things.
Well, just about, isn't it?
Okay, feel some water shooting at your foot. All right, so you just got a wad of pain relief, okay? What I'm going to start doing is cleaning this wound up.
Yep.
We're going to bandage it.
Yep. Well.
And I can guarantee you, we'll splint it, it ain't going to tickle.
Part of making Rob comfortable is splinting that leg so it just doesn't move. So then we can do things like elevate it and all the simple things that you do to ensure that there's really no more complications.
All right, so we'll just get this splint on, keep this joint nice and tight. Well, you want to prevent further damage to nerves as well as blood vessels. I mean, the bone is what it is now at the moment. And we're almost ready to roll, really.
As the air ambulance crew prepare for the 45-minute flight back to Melbourne's Alfred Hospital, Rob's now feeling guilty about his wife Trudy having to drive 2 hours off the mountain on her own.
You don't worry about me, you just be careful getting home.
Yeah, I'll be right. Okay, go down.
I knew we were going to get out. I wasn't worried about that, but I was more worried about how my mate was going to cope. That's a bit scary, like you're stuck up there miles from anybody and dark and wildlife on the road. There's a creek to get across. Some of the switchbacks are a bit rough.
Just sitting right turn, rolling, that's right. That was clear.
Trude's my best mate. It was hard.
M1 airborne for the Alfred with an ETA there of 1752. Yeah, that's right. They're expecting you about that time. Thanks, mate.
Farmer Rob is being airlifted to the Alfred Hospital after a tree fell on him in Victoria's remote high country.
Meter's coming on. This will warm up pretty well. About 5 minutes.
His wife Trudy, a nurse, managed to cut her husband free, bandage his severely broken ankle, and get him to the chopper.
Yeah, no, much better, thanks.
Glad I had Trudy there, not somebody else. Because I know if she says we're in the pub, we're in the pub. If we're not, we're not. I didn't actually think it was as bad as what it turned out. Like, I felt the pressure on my leg, and then I heard Trudy's voice saying, "Oh, Webby." And I thought, "Oh, this doesn't sound too good." And then when I looked down and had a look at my leg, I thought, it doesn't look too good.
With such a bad injury, Ray, the Micah flight paramedic, keeps the pain relief coming.
I was just going to give you a little bit now, a little bit when we get to hospital. Just keep you nice and comfy. Yeah,
I'm looking at that ankle and thinking he's a farmer and he loves being outdoors and is quite active. If this joint's not fixed properly, he will lose mobility, he could lose his livelihood, he could lose his love of the bush. He can't afford in his profession and what he does for a living, and he can't afford it in his lifestyle.
On the ground about 3 minutes, guys. Great, thank you.
But right now, Rob is just grateful to the team for getting him off the mountain.
On the ground.
You can't say much because thanks doesn't seem like enough. One way to get to Melbourne, isn't it?
It's quicker than driving.
Pretty amazing that there's people out there that do that for other people.
Now in the capable hands of the Alfred medical team, Rob's about to find out his fate. This injury could change the course of his life. 10 weeks ago, a tree fell on Rob and smashed his ankle during a four-wheel driving trip with his wife Trudy in Victoria's remote alpine country. The farmer was emergency airlifted off the mountain, while Trudy managed to drive their vehicle out of the difficult terrain and join her husband in hospital. Surgery was needed to repair his broken fibula, and screws were inserted into his ankle.
Not very hungry today, girls. Too much food.
Fortunately, after intensive rehab, Rob is now back working on his property.
Come on. Considering we haven't had too much rain, you don't look too bad, girls.
Look at you, big fella.
There you go.
How you doing? More to the point.
Going right.
Good to see you walking.
Yeah, going good.
Going good?
And today, Ray, the flight paramedic who helped rescue him, has dropped by to check on his patient's progress.
Come inside.
Come in.
He was as white as a sheet and I was hoping he didn't pass out. And once you guys landed, it was like, my job's over. Look after him.
No, you did all the hard work, not us. Don't worry about that.
You know, I get a bit emotional about it sometimes, but it's amazing that people will come like you and do their job to help somebody else out.
Rob and Trudy both extremely grateful, and that's quite heartwarming for us. We don't do it for the thanks or the kudos. We just do it because that's what we love doing. We love helping people.
Life-changing, to be honest.
Thank you very kindly on behalf of all of us.
Yeah, I really appreciate it. Every time I see a red helicopter, I'll think about them. Not just Ray, the whole lot of them are just amazing blokes. And can't thank them enough.
Emergency services.
I'm at the scene of a car accident.
Whereabouts?
Anderson roundabout near San Remo.
At the Emergency Communications Centre, an urgent call has come through from country Victoria, where a motorist is desperately trying to escape her mangled car.
The car's wrapped around the power pole and her legs are jammed between the steering wheel and the seat, and the driver's side door had hit the power pole.
It's the second accident on this stretch of road today, and emergency services arrive quickly on the scene. A 150 kilometres away in Melbourne, Micah Air Ambulance paramedic Matt is on his way to join them.
Did you know if they've got the road closed or we haven't got that?
I haven't got that information. There's somebody turning up at scene now, supposedly going to give us a further details.
Is that actually the scene? I can't actually see it.
The scene will be further down in this direction, just underneath your nose now.
Copy. Oh yeah, sighted.
Yep.
Yeah, visual.
There is a ambulance vehicle up at the lookout where we're going to.
Okay. Copy.
The driver has just been extracted from the vehicle and is receiving emergency care from a local ambulance crew.
Someone's checked that power pole as well. She's hit that at force.
As Matt makes his way to assess the patient's injuries, he inspects the wreckage for clues.
So that's hit her in the back of the head, obviously 80 to 100 Ks.
Yeah.
Swinging him backwards into the pole. Yep. So that's obviously what's come back through and hit her in the back of the head. And that's fiberglass, isn't it?
When you look at the vehicle, it's obviously been travelling at speed and has collided with the pole, causing the back canopy to actually come up from where it is, and it's speared through the back windscreen and into the passenger compartment. The potential is absolutely horrific. The canopy could be decapitating the patient or causing significant head injury to the patient, so we've got no idea what we're going to walk into here.
Hello, Cherie. My name's Matt. Pleased to meet you.
She does have a hematoma and a lac to the right vesicular region on the back of her head, which is quite big.
Yeah, okay.
The high-impact collision has caused lacerations to Cherie's head. The 49-year-old is lucky to be alive.
When you consider the force that's required to cause that back canopy to go up and spear into the back of her vehicle, potentially she could have been decapitated.
So Well, I'm just going to have a quick listen to your chest, so I'll get you to do some more big, deep breaths for me, please. So breathing feels okay. The main pain is just at the back of the head?
Yeah.
And it's right at the back, is it? Or more on this side? No worries. And this collar probably makes that feel really nice, doesn't it?
Yeah.
No worries.
Incredibly, Cherie has survived in one piece. The same can't be said for her outfit.
The other thing I do want to do is cut off your clothes a bit so we can actually have a look and make sure we're not missing anything. So, unfortunately, all your nice, neat gear is going to need to get it
dress. It's the first time I've ever worn it.
Ah, there you go.
I know.
There you go.
This wasn't meant to happen.
We often get cases where the patients tell us they've just purchased something new or it's their favourite jacket and all that sort of thing. But ultimately, at the end of the day, we need to assess you properly. And if that means cutting through your best dress, then unfortunately it's going to have to go.
Cherie will now be airlifted to Melbourne's Alfred Hospital.
Come up. Just taking off. Are you comfy there? Lovely.
Matt's main concern now is keeping her in good spirits.
Welcome to the cloud. That's all we can see.
I think to be able to operate as a good clinical paramedic, you have to be able to relate to people.
So what will I do? Just check out my head?
Yeah, amputate, usual stuff.
Shave my head?
That's it. You want the idea to cut off your ponytail.
Oh, you were hanging, weren't you?
Yeah, and the shears.
I thought so.
It's that thing that laughter is one of the best medicines that you can have, and it takes people's focus away from thinking about their injury and their illness that they've got, and sometimes just helps them relax. Just the small things like that can make such a big difference in the patient outcome.
You'll probably get an X-ray, may even do a CT scan.
Cherie will be admitted to the trauma centre to determine if she's sustained any internal injuries.
Everyone good? Yeah, good to go. Yeah. You know, I love my job. I'm 20 years in the job now, and I still, every day, more than happy to go to work. It's very interesting, lots of good fun. We get to help lots of people. And TLC is the best drug we have in our bag. If you give people lots of TLC, it makes an immediate impact on their care from the start.
Thanks, Matt.
I'm not behind you, you don't have to yell at me.
Okay. Yeah, well, keep on your toes.
It's several weeks since 49-year-old Cherie's near-death experience at the wheel of her car. After narrowly avoiding a major head injury, she was airlifted to hospital.
I had about 6 staples put in my head. They were taken out 7 days later, but I'm still got a lot of scarring and things still there, so it hasn't recovered properly. No, not yet. The first time I actually saw the car after the accident, I was totally shocked. It was 100 times worse than what I actually thought. It was like, oh, wow. When I look at the car now, I just realise how lucky I was. So lucky, and lucky that I didn't hit anybody else.
But Cherie's even luckier than was first thought. Emergency call maker Sally nearly didn't stop to help.
Apparently, because there was an accident prior, a lot of people actually drove past, but Sally noticed my headlights were on, so she stopped. I think she turned around and come back and checked to see that, and then she noticed somebody was in the car and was like, oh, what am I going to see?
Hi, how are you? Good, thanks. Good.
Today, Sally is here to meet with Cherie for the first time since the accident.
I remember being so shocked when I put my head in the cabin. I was talking to you and then just looking around and there was just shattered glass everywhere.
I was so grateful Sally was there. If she wasn't there, I might have done something stupid like try and climb out of the car. I could have really injured myself or hurt myself. But yeah, Sally kept everything calm.
And I'm glad that you're doing well too.
Yes, thank you. Yeah, I am. Thank you.
To know that she's doing well and to see her walking around today, and she looks a darn sight better than she did that day, I can tell you, because that accident could have been a lot worse. Yeah.
I know I'm the one who went through the so-called trauma, but it would have been traumatising for you too. You didn't know what you were pulling up into. You didn't have to help. You didn't have to do anything. Nobody else did. You did. So thank you so much. Thank you.
Quick fight and be like, yeah, I know, 10 minutes. 10 minutes, yeah.
At the Air Ambulance headquarters, mobile intensive care paramedic Matt is on his way to the scene of a high-speed two-car crash 50 kilometres northwest of Melbourne.
There's limited information at this stage as to what's going on. What we know is that it's a country road, approximately 100 k's an hour, so the potential for a significant smash from this scene is quite a big possibility.
Roger.
Each week in Victoria, at least 10 seriously injured accident victims are flown by air ambulance crews to major trauma hospitals.
We're 1 minute out. Got the scene 12 o'clock on the main road. Roger.
This time, it's taken less than 15 minutes for the chopper to get to the scene. Every moment is crucial in the bid to save a critically injured patient.
Within a metropolitan area, if you have a big car crash, within a short period of time you'll get the police, the fireys, the SES and dozens of ambulance people turning up to the scene. You put that same car accident in a country location, your resources are far less. So we need to be prepared for anything. Yeah, I've got the monitor, so we're good to go. Hey, how you going?
I'm good, how are you?
Good.
Matt's patient is 21-year-old Natalia. Her boyfriend, who is driving this blue sedan, has already been taken to hospital by another ambulance team.
Got a lot of pain at the moment?
Yes.
You have? Whereabouts mainly?
My hips, my stomach, my neck and my head.
No worries.
Get the car in.
Yeah, if we get the car in, we'll just load into the car so we can get her out of the cold and keep her warm. You're just going to put ours straight on, Don? Yeah. Thanks, mate. No worries. I'm just going to have a quick look at the car. I'll be back in a tick.
With Natalia being given pain medication, Matt goes on a fact-finding mission at the crash site.
Step around. It's very easy to walk into a scene and become tunnel-visioned and go directly towards a patient. And if I just look at the patient and just assess them, I only get half the picture. Whereas if I walk around the scene and actually look at the vehicles and I can look where the forces have been displayed onto the car, which are also then transmitted onto the patient, it gives me more of the story as to actually what's gone on. So not much intrusion in the cabin or anything like that. The windscreen's smashed, but that's probably going to be more due to the damage to the body of the car more than anything else. And then when I take that back to assessing the patient and I look at them and I go, are you sore here, are you sore there? They'll probably say more than likely yes. And that's where they've received the impact. So Natalia, we're just cutting your clothes at the moment because we need to have a proper look at you and make sure everything is okay. Where's that hurting?
But as Matt starts searching for any internal injuries, Natalia shows some other worrying signs.
So you remember the whole incident, do you?
No, I don't even know why we're here.
You've been in a car accident. There's been a big hit on the other vehicle, probably more so than your vehicle.
I just can't remember.
Maybe she's knocked her head and she has a small bleed inside her brain. So we need to gauge what's going on with Natalia as to how severe this head injury is.
What about everyone else? Are they okay?
Yeah, everybody else is okay. They're all gone to a hospital as well in other ambulances. Just relax.
Natalia was in the passenger seat with her boyfriend driving. She can't remember the accident.
Don't you remember me telling you that? I reckon that's the 4th time you've asked that.
Matt's now concerned his patient may have suffered a serious head injury.
So Natalia doesn't have a great recollection of what's actually occurred with the incident, which usually means to me either, it's a horrific experience that the patient really doesn't want to remember, or they've had a knock to their head, which has caused them to pass out and lose consciousness. That's sore both sides, is it?
Oh, yeah.
Natalia's also complaining about severe pain in her abdomen, potentially a sign of dangerous internal bleeding.
Now, we're just going to do a quick ultrasound of your tummy, so just relax your arms down by the side there. The ultrasound gives us a look inside the person's abdomen, and if there is a small bleed that's going on around the kidneys or within the abdomen somewhere, we're able to recognise it with the ultrasound. Where's that hurting? In the middle of your tummy there? No worries, okay. Now I'm going to do the same thing that I just did on that side, just on the other side for you. With any car accident, everything inside your body is still moving, so it hits an object, but the organs inside your body are still moving, so they bash into the front of the abdomen, or they bang into the seatbelt, or they can tear off things within inside your body, which can cause internal bleeding and internal injuries. Where's that hurting?
Oh, my hips.
Your hips? No worries, okay. With the ultrasound, I'm looking for specific injuries around her kidneys and whether she's damaged her liver or spleen, whether she's damaged her bladder. She could have injured her pelvis or she could have injured her hips in some way.
So there's no bleeding inside your tummy that I can see at this moment. Now I'm just going to pop this around your arm. So your tummy's very tender to touch, is it?
Yeah.
Yeah.
Especially my hips.
Your hips? Both sides?
Yeah, both sides.
Can you bend your knees up towards your chest for me? See how that goes. Yeah.
Yeah, I can.
Where's that hurting?
Yeah.
Can you just relax your legs down again for me? I'll pop the needle in her arm.
Natalia's obviously got something going on with either her lower abdomen, maybe her pelvis. She's had a bang on her head. She's got an altered conscious state because of that. So it's important for us to recognise the potential for her injuries and take her to the appropriate facility.
So we're going to take you to the Alfred Hospital. You're going to go in the helicopter on the way there.
No, thank you so much.
And your boyfriend's in excellent hands, all right? You'll be able to chat to him shortly.
Thank you.
I'm just going to lower the back of this bed down for you a touch, okay? So just relax back with it.
50 kilometres northwest of Melbourne, Micah paramedic Matt and the air ambulance crew are about to airlift their patient Natalia to a trauma hospital.
Side, ready?
Oh, no.
1, 2, and 3.
Oh.
Breathe with it, breathe with it, it's okay. And back on 3, 1, 2, and 3.
Oh.
Natalia's been in a significant car crash. You know, any vehicle that gets hit by another vehicle at potentially 100 kilometres an hour has the possibility of having significant injuries.
I'm just going to lift your head up slightly.
Yeah.
The 21-year-old hit her head during a high-speed accident on a country road and is suffering from memory loss. She also has severe pain in her abdomen and hips.
Where's that hurting? Your tummy still?
Natalia's partner has already been taken to the local hospital with minor injuries. But despite repeated reassurances, her amnesia is stopping the message getting through.
With Natalia, it's a horrible situation to be in because she's been told what's happened to her boyfriend. Then a minute or two later, her brain has sort of wiped that information that you've just explained to her from her brain. And so now she's asking those same questions again. So all we can do as paramedics in those circumstances is just continue to provide reassurance.
You're going to be okay.
Thank you so
All right,
much.
so just take some nice big breaths. Just relax, okay?
Because it's one of those things that at a car accident, the people involved in the accident get separated. One goes in one ambulance, one goes in another ambulance, one goes in a helicopter.
Bit of a scary thing to go through.
So you get separated from how your partner or how your friend is actually going, and so you get this element of concern and anxiety that's associated, which can make things much worse for the patient.
You're going to be okay. Nothing more is going to happen now. Heart rate's good, blood pressure's good.
Tender loving care is the best management that we have. By me sitting down and holding their hand and say, it's going to be okay, we're here to look after you, you can automatically see straight away decrease in patients' respiratory rate, their anxiety levels decrease, and which has an overall effect on their heart rate, their blood pressure. Having a good emotional connection and support to your patient is probably the best management that we can do.
The main thing is your partner is okay and the other person's fine as well. Everybody's come out of it all right.
We can't stop accidents occurring, but what we provide as paramedics is emotional support and care through probably one of the most traumatic experiences of these people's lives.
So as we start to get near the helipad at the hospital, the helicopter does a little bit of shaking, which is a normal thing, so it just seems to vibrate an awful lot. And the pilot we've got is pretty terrible, so it seems to vibrate more than normal. Really? He's got a name called Shonky for a reason.
Just what lasting legacy Natalia will have from the traumatic crash won't be clear until extensive testing has been carried out.
We'll get you down to the hospital and get you seen and sort you out.
We often think of car accidents just being the physical injuries that people sustain, but it's also the emotional and mental impact that those car accidents can have on a patient in their long-term recovery.
Yep, no worries, just a bit of cool air as you come out, okay? Just nice big breaths, you're going to be okay. That's...
It's been 3 weeks since Natalia was involved in a high-impact car crash, which left her in severe pain and with no memory of the traumatic accident. The 21-year-old is still making a slow recovery from neck and back problems, but doctors did clear her of any major internal injuries. Fortunately, her memory has come back, including the reassurance she received from flight paramedic Matt.
So when he told me that, oh, you're actually really good, you're doing really well, and you seem to be healthy, nothing broken, that really calmed me down. But I was still worried about everyone else, so I started crying. So he just wiped my tears off my face, and that made me feel really nice to know that there's people here, they're caring for me, and everything's going to be okay.
This one, a 24-year-old male who's had a tree fall in his leg, caused a hip fracture. ETA into the area about 20 minutes.